Right now, as you sit here, your heart may be quietly waving red flags that nobody has ever taught you to read. Not complicated flags, not flags that require a machine or a specialist or a hospital visit. Flags you can see with your own eyes, flags you can feel with your own fingers, flags sitting right there on your body at this very moment. And here's what stops me cold every time I think about it. Nearly half of American adults over 40 may be living with some form of heart disease they know absolutely nothing about. Nearly half. That is tens of millions of people going to work, grocery shopping, visiting grandchildren, completely unaware. The warning signs are there. They have always been there. Nobody ever sat down and said, "Here, let me show you what to look for." Today I am going to change that. I will walk you through 7 hidden signs of heart disease you can check on your own body right now in the next 30 minutes. These are the same clinical clues I use every single day when I assess patients. You do not need a medical degree to recognize them. You just need someone to explain them properly. And I need you to stay all the way to sign number 5, because that one is found somewhere most people never think to look. It surprised me the first time I learned it, and it has surprised every patient I have ever shown it to. But first, what country are you watching from right now? Drop it in the comments below. I want to know where you are. Now let me tell you about Sandra. She represents a pattern I have seen dozens of times throughout my years of practice. 67 years old, retired postal worker from Virginia. She came in because her daughter had practically dragged her through the door. Sandra felt fine. She had felt fine for years. She thought the visit was a waste of a Tuesday afternoon. She was wrong. I want to come back to Sandra's story as we go through each of these signs, because what I found in that examination room, it changed everything for her family. But first, I need to explain something. Something the medical system rarely has time to sit down and walk you through properly. Your doctor is not hiding information from you. I want to be clear about that. The problem is structural. The average primary care visit in America runs about 7 minutes. 7 minutes to review your chart, answer questions, renew prescriptions, document everything, and send you on your way. In 7 minutes, your doctor cannot walk you through the clinical art of self-examination. They cannot explain what a pitting edema test is, or why your sleeping position matters, or what to feel for in your own pulse. The system does not give them time. That is not your doctor's fault. It is a system built around billing codes, not education. And the people who pay the price for that gap are you. People who are 60, 65, 70 years old, walking around with signs they cannot read because nobody ever taught them the language. That ends today. Sign number 1. How many pillows do you sleep with? I know that sounds like an odd medical question, but stay with me for 90 seconds. This single question has changed outcomes for more of my patients than almost anything else I ask. What I am really getting at is this. Can you lie completely flat in bed and breathe normally? Or does lying flat make you feel short of breath, slightly suffocated, like you need to sit up to get comfortable? Here is what is happening in the body when the heart starts to struggle. Picture your heart as a pump in the basement of a building, connected to a network of pipes that run up through every floor. When that pump loses strength, pressure builds up in the system. Fluid backs up into the pipes that feed the lungs. And when you are upright during the day, gravity helps keep that excess fluid pooled lower in the lungs and the legs. But when you lie flat at night, the fluid redistributes. It spreads throughout the lung tissue. Breathing becomes like trying to inhale through a wet sponge. The medical term for this is pulmonary edema, fluid in the lungs due to heart failure. And here is the insidious part. It almost never appears all at once. It creeps in over months, sometimes years. One night you notice you are slightly more comfortable with an extra pillow. A few months later you add another. Eventually you are sleeping at a 45-degree angle and you have completely forgotten there was a time when you could lie flat without thinking about it. Here is a simple self-test. Tonight, before you get into bed, try lying completely flat. No pillows, just flat on your back. Can you breathe comfortably? If you feel short of breath within a minute or two of lying flat, if you feel the urge to prop yourself up, that is a clinical sign called orthopnea. And orthopnea is one of the classic early warning signs of heart failure. Now, this does not mean lying flat is impossible for anyone without heart disease. Some people just prefer pillows. But if you notice this is a change from how you used to sleep, if you used to sleep flat and now you need elevation, that change is the important detail. Bring it to your doctor. When I asked Sandra about her sleep that Tuesday afternoon, she paused for a moment. Then she laughed slightly and said she had not slept flat in about 2 years. She had 2 pillows, then 3. She said her daughter kept asking if she was sleeping okay, and Sandra kept saying yes. She felt fine lying at an angle. She had just assumed it was getting older. That is how quietly it happens. Sign number 2. Can you climb a single flight of stairs without unusual breathlessness? This might sound like a fitness question. It is not. It is a cardiac stress test you can perform for free in your own home. Here is why stairs are different from walking. When you stroll through a grocery store or take a leisurely walk around the block, your heart is working at a relatively modest level. It can compensate. It can hide its weakness. But climbing stairs forces the heart to increase its output by 30 to 40% in a very short window of time. That is when compensated heart disease stops compensating. Think of it like a car with a slightly failing engine. It might idle fine at a red light. It might cruise down a flat highway without a problem. But the moment you press the accelerator to merge onto the freeway at speed, you hear the knock. The problem was always there. The engine just had not been pushed hard enough to expose it yet. Stairs expose it. So the test is simple. Climb 1 flight. Normal pace, not rushing. How do you feel at the top? If you are noticeably more short of breath than you would have been 6 months or a year ago, if your legs feel heavier or your chest feels tighter than it used to on that same staircase, pay attention to that change. Do not normalize it. Do not chalk it up to age. Change is the signal. And here is something important I want you to understand before we go further. All 7 of these signs share one common thread. None of them are dramatic. None of them will make you feel like you are having a heart attack. They are quiet. They are gradual. That is exactly what makes them dangerous. And that is exactly why nobody catches them until something serious happens. Sign number 3. Are your ankles swollen at the end of the day? This one you can check right now, wherever you are sitting. Look down at your ankles. Do they look puffier than usual? Do your socks leave deep indentations around your ankle when you take them off at night? Do your shoes feel noticeably tighter in the late afternoon than they did in the morning? And here is the clinical test. Press your thumb firmly into the skin just above your ankle bone. Hold it there for about 20 seconds, then slowly release. Look at the spot where your thumb was. Does a small dent remain in the skin for a few seconds before it fills back in? That is called pitting edema. And what you are seeing when that dent holds its shape is fluid. Fluid that has leaked out of your blood vessels and pooled in the surrounding tissue. Now let me explain why the heart connection matters here. The heart's job is not just to pump blood out to the body. It also has to receive blood back from the body through the veins. When the heart weakens, when it cannot receive and pump efficiently, blood backs up in the venous system. Pressure builds in those veins. And eventually that pressure pushes fluid out through the thin walls of the blood vessels and into the tissue. The ankles and legs are hit first because gravity pulls that fluid downward. It is the same mechanism as the fluid in the lungs we talked about earlier. Same root cause, same failing pump, but showing up in different places depending on the stage and type of heart failure. Now, swelling alone is not always a heart problem. Prolonged sitting, varicose veins, kidney disease, certain blood pressure medications, all of these can cause ankle swelling. So one sign in isolation does not tell us everything. But when you start seeing multiple signs from this list appearing together, the picture becomes much clearer. I asked Sandra about her ankles. She looked down and then looked at me. She said, "Well, they are a bit puffy." But I figured that was just standing on my feet all those years delivering mail. I never thought it meant anything serious. She pressed her thumb into her ankle while she was sitting there. The dent held for nearly 5 seconds. Sandra kept her posture very straight in the chair. She did not say anything for a moment. Then she said, "Should I be worried?" I told her I was going to find out, and I told her to keep listening. Sign number 4. Is your pulse regular? Here is something remarkable. You can screen for one of the most common and dangerous heart conditions in the world using nothing but 3 fingers and 60 seconds of your time. Place your index, middle, and ring finger along the inside of your wrist, just below the base of your thumb. Press gently until you can feel a clear pulse. Now pay attention, not to how fast it is beating, to the pattern. Does it feel like a steady, even drumbeat? Regular, predictable, the same interval between every beat? Or does it feel more like a drummer who keeps losing the rhythm? Beats that come close together, then space out, then cluster again, with no discernible pattern you can follow? If it feels irregular, if the pattern seems genuinely random rather than just slightly variable, You may be experiencing something called atrial fibrillation. And I want to spend some time here because this one is critically important. The heart has 4 chambers, 2 on top, the atria, and 2 on the bottom, the ventricles. In a healthy heart, the electrical system works like a precisely timed orchestra conductor, triggering all 4 chambers in an organized, coordinated sequence with every beat. In atrial fibrillation, the upper chambers stop following the conductor. They start firing chaotically, 200 to 400 times per minute, in completely uncoordinated spasms. Think of it like a room where everyone is clapping. In a normal heart, the conductor lifts the baton and everyone claps together. In atrial fibrillation, someone knocks the conductor off the podium and everyone just claps whenever they feel like it. The room fills with noise and disorder. What does this mean for your body? It means blood is no longer moving through those upper chambers efficiently. Blood that sits still pools. Blood that pools clots. And those clots, once they form, can travel through the bloodstream. If a clot reaches an artery supplying the brain, that is a stroke, a sudden, devastating interruption of blood flow to one of the most delicate organs in the body. If a clot blocks blood flow to the intestines, that is bowel ischemia, a life-threatening emergency. A major analysis published in the journal Circulation, following over 30,000 adults over age 65, found that people with undetected atrial fibrillation had roughly 5 times the risk of stroke compared to people with normal heart rhythm. 5 times. And perhaps most alarming, a significant portion of those individuals had no symptoms, no palpitations, no chest fluttering, nothing to warn them. They felt completely normal, right up until they did not. Take 60 seconds right now. Check your pulse, both wrists if you can. If the rhythm feels off, not just fast, but genuinely irregular and unpredictable, do not dismiss it. Write it down. Note the time. Note how you were feeling. And bring it to your doctor with that specific information. Many newer smartwatches can detect atrial fibrillation and send you a notification. If you have one, use that feature. But your fingers are available right now, this moment, for free. And sometimes they catch it first. Let me check back in on Sandra. Her pulse was regular that afternoon. That was good news. But the pattern of findings was still accumulating. 3 pillows at night, pitting edema in both ankles, increased breathlessness on stairs compared to 6 months earlier. Each one alone might mean nothing. Together, they were building a picture. And if any of what I am sharing today is helpful, please hit the like button right now. It costs you nothing. But it tells the algorithm that this kind of content matters, and it puts this video in front of people who need it, people who might not know to search for it, people who are walking around right now with signs they cannot read. Your like genuinely helps reach them. Sign number 5. Look at your fingernails, specifically your nail beds. I told you at the beginning this one would surprise you, and I meant it. Your heart has valves that act like one-way doors between its chambers and the major blood vessels. The most important of these is the aortic valve, the exit door from the heart's main pumping chamber, the left ventricle, out into the aorta, the largest artery in the body. When the aortic valve functions normally, it opens when the heart contracts, lets blood through, then snaps shut tightly to prevent backflow. But in a condition called aortic regurgitation, the valve becomes leaky. Instead of snapping shut cleanly, it lets blood flow backward with every heartbeat. Some of the blood the heart just pushed out comes right back in. Over time, the heart compensates. It enlarges. It pumps harder to make up for the backflow. The pressure swings in the cardiovascular system become more exaggerated with each beat. More pressure forward, more pressure backward. And those exaggerated pressure waves travel all the way to your fingertips. Here's what to look for. Hold your hand up in front of you at roughly eye level. Look at the pink area just under your fingernails, the nail bed. Watch it while you stay still. Do you see any faint rhythmic pulsation there? A subtle flush of pink that beats in sync with your heart? This is called Quincke's sign. And when it is visible, it means the pressure difference between each heartbeat is abnormally large, a classic sign of significant aortic regurgitation. Now look at the shape of the fingertips themselves. Are the ends of your fingers noticeably rounded and enlarged compared to the middle segment? Does the nail seem to curve downward more than usual, almost like the nail is wrapping around the tip of the finger? This is called clubbing. And here is what causes it. When the body is chronically deprived of adequate oxygen, when the oxygen saturation at the tissue level is persistently low over months and years, the small blood vessels at the fingertips proliferate. They multiply. They try to compensate. The result is that the soft tissue under the nail thickens and the fingertip itself enlarges and rounds out. Clubbing can be caused by heart disease, certain lung diseases, or other conditions that impair oxygen delivery. But in every case, it is the body's long-term response to oxygen deprivation at the tissue level, and that is not a message to ignore. Here is the self-test for clubbing. Press both of your index fingers together with the nails facing each other, the undersides of the nails touching. Look at the small gap that forms at the base where the nails meet the fingers. In a normal hand, you should see a small diamond-shaped window of light through that gap, a clear opening. If that diamond gap is absent, if the nails press together flush with no gap at all, that is a positive Shamroth sign, and it is worth bringing to your doctor's attention promptly. Sign number 6. Look at the sides of your neck. The next time you are standing in front of a mirror, look at the sides of your neck, just below your jaw and along the large muscles that run from behind your ear down to your collarbone. Stand still. Breathe normally. Do you see visible pulsations? Not just a very faint movement, but actual visible throbbing with each heartbeat. Visible enough that someone watching you from across a room might notice it? Now look a little lower, toward your collarbone area. Do you see the veins in your neck bulging or standing out prominently when you are sitting upright or even just standing? That second finding is called jugular venous distension, and it happens when the pressure inside the right side of the heart becomes elevated. When the right side of the heart cannot accept blood returning from the body efficiently, that blood backs up into the venous system. The jugular veins in the neck are directly connected to the right side of the heart. When the pressure rises there, it rises all the way up into the neck veins, and you can see it from the outside. This is one of those findings that seems almost too straightforward, that the pressure inside your heart could be readable from the surface of your neck. But that is exactly how it works, and cardiologists use this clinical finding every single day. The visible neck pulsations from aortic regurgitation that I mentioned with sign 5 have their own name, Corrigan's pulse. The more pronounced pulsations that involve the head moving subtly with each heartbeat are called de Musset's sign. These findings are less common than the others on this list, but when present, they indicate significant cardiovascular disease. You are also looking in the uvula sometimes, the small piece of tissue that hangs at the back of your throat. In significant aortic regurgitation, you may see it pulsating rhythmically if you look in a mirror with your mouth open and a flashlight. This is called Muller's sign. These are rare, but rare does not mean impossible, and knowing they exist means you will recognize them if you see them. Here is what ties signs 5 and 6 together. Both are manifestations of exaggerated cardiovascular pressure. Both are the body speaking loudly about something happening at the mechanical level of the heart. The difference is where you look. The fingernails speak about oxygen delivery to the periphery. The neck veins speak about pressure returning to the central pump. They are telling the same story from different angles. Now let me bring Sandra back in. She did not have visible neck vein distension that day. That was reassuring. But the other pieces were accumulating. And I want to tell you what happened next in her examination, because it connects directly to the 7th sign. Sign number 7. Look closely at your eyelids. Go to a mirror if you can. Stand close. Look at your upper and lower eyelids, particularly near the inner corners, the part of the eyelid closest to your nose. Do you see any small yellowish patches? Slightly raised areas, almost waxy looking, with a pale yellow or cream color sitting just beneath the surface of the skin. These are called xanthelasma, and they are deposits of cholesterol-rich material accumulating under the skin of the eyelids. Now let me be precise about what xanthelasma means and what it does not mean. Xanthelasma itself will not hurt you. It is not a sign of heart failure. It is not a cardiac emergency. But it is a visible external marker of something happening internally, and that something matters enormously. Xanthelasma indicates disrupted cholesterol metabolism. The lipid particles in your bloodstream are not being processed and cleared normally. Some of them are spilling out into the tissue of your eyelids. And here is why that matters for your heart. When cholesterol particles are not being cleared efficiently from the bloodstream, they do not just show up in your eyelids, they show up in your arteries. Specifically, they infiltrate the inner lining of artery walls, where they become oxidized, get engulfed by immune cells, and eventually form the plaques that narrow and harden the arteries. This process is called atherosclerosis. Think of the inside of a healthy young artery as the inner surface of a brand new pipe, perfectly smooth, perfectly clear, with blood flowing through easily in every direction. Now picture that same pipe after 30 or 40 years of cholesterol particles, oxidized fats, calcium, and cellular debris accumulating on the inner wall. The pipe does not fail overnight. It narrows slowly. The walls stiffen. Blood pressure rises because the heart has to push harder to move blood through a narrower passage. And then one day, a piece of that plaque breaks loose. A fragment of the hardened inner wall detaches and travels downstream in the bloodstream. If it reaches a coronary artery, the artery feeding the heart muscle, it blocks blood flow. The heart muscle starves for oxygen. That is a heart attack. If it reaches a cerebral artery, the artery feeding the brain, blood flow stops. That is a stroke. This is the entire story of cardiovascular disease compressed into a few paragraphs, and xanthelasma is a visible window into the early stages of that story. A large population study conducted over more than 2 decades, published in the British Medical Journal, found that the presence of xanthelasma was associated with a statistically meaningful increase in the risk of heart attack and cardiovascular events, independent of cholesterol levels measured in the blood. Meaning some people develop xanthelasma even with cholesterol numbers that look acceptable on standard tests. The deposits were pointing to a problem the routine blood panel was not fully capturing. I want to be honest with you here. Xanthelasma alone is not an emergency. If you see small yellow patches on your eyelids today and you have never had them checked, the appropriate response is not panic. The appropriate response is to call your doctor and ask for a full cardiovascular risk assessment. Cholesterol panel, blood pressure, heart health history, family history, a complete picture. Because xanthelasma is a message. It is not a verdict. It is your body posting a note on the outside of your door saying, something is worth checking inside. Now let me finish Sandra's story. When I examined her eyelids that afternoon, I saw small but unmistakable yellowish patches near both inner corners. She had not noticed them. Or perhaps she had noticed but thought nothing of it. She was not the kind of person who studied her own face carefully in the mirror. She was the kind of person who got up, got dressed, and got on with things. 3 pillows. Pitting edema in both ankles. Mildly increased breathlessness on stairs. Xanthelasma on both eyelids. Her pulse was regular. No visible neck vein distension. No fingernail changes I could identify clinically. But the 3 signs together were enough. I ordered a comprehensive cardiac workup that same afternoon. Echocardiogram, full lipid panel, BNP levels, a blood marker for heart strain, electrocardiogram. I want to tell you what we found. But before I do, if you have found this video valuable so far, save it right now. Bookmark it, because this is the kind of content you are going to want to come back to, not just for yourself, for your sister, your spouse, your parent who is convinced they are fine. Save it and share it with one specific person in your life who is over 50 and has never heard these things explained. I will be right back with Sandra's results. And then I have something important to walk you through. A week-by-week guide to what happens when you bring these signs to your doctor and what realistic improvement looks like, so that if you go through this process yourself, you know exactly what to expect. Sandra's echocardiogram came back showing early-stage diastolic dysfunction. That is the technical term for a heart that has begun to stiffen and struggle with filling properly, the earliest recognized phase of heart failure. Her ejection fraction was preserved, which meant the pump was still working at adequate strength. But the relaxation phase, the moment between beats when the heart fills with blood, was impaired. The pressure was building. The early fluid accumulation in her ankles and lungs was the downstream result. Her lipid panel showed total cholesterol elevated well above the range associated with low cardiovascular risk. Her LDL, the cholesterol most directly associated with plaque formation, was significantly elevated. Her BNP level was mildly elevated, consistent with the early heart strain the echo had shown. Here is the most important sentence in Sandra's story. None of this was discovered because Sandra felt sick. She felt fine. She felt fine right up until the moment she was sitting across from me in that examination room, and I showed her what her body had been trying to say for at least 2 years, maybe longer. Early stage diastolic dysfunction. Managed with the right combination of lifestyle modification, blood pressure optimization, and cholesterol treatment, the progression can be slowed. The symptoms can be controlled. The gap between where she was and where she might eventually be without intervention can be widened significantly. That gap is called time. And time, when it comes to heart disease, is the most valuable thing modern medicine can give you. Her daughter called me 3 days after we started Sandra's treatment plan. She said, she keeps walking up the stairs and telling me how she feels at the top. Every time. She is so relieved and a little angry that nobody caught this before. I told her daughter that was a completely reasonable response. The anger and the relief together. Now, I want to walk you through what happens after you recognize these signs and bring them to your doctor, because this is something most medical content never addresses. And when people do not know what to expect, they often give up too soon. If you recognize one or more of these 7 signs and you schedule an appointment to discuss them, here is a realistic picture of what the next several weeks look like. Week 1, you go in. You describe what you noticed. You bring notes if possible. Your doctor examines you. Depending on what they find, they will likely order tests. An electrocardiogram, which is a simple heart tracing done in the office, possibly a chest X-ray. Blood tests, including a lipid panel, kidney function, and possibly BNP. Do not leave that appointment without asking for specific test orders. Do not accept, let's just see how you're feeling, if you have multiple signs from this list. Here is something I need you to hear. It is completely acceptable to print out the list of signs from this video and bring it with you to your appointment. It is completely acceptable to say, I watched an educational video and I want to discuss whether any of these apply to me. A good physician will welcome that engagement. If yours does not, that is information about whether you need a second opinion. Week 2 and 3. Test results come back. This is where it gets emotionally complex. You may feel fine, and then see numbers on a piece of paper that say something different. That gap between how you feel and what the tests show is disorienting. I have watched patients go through it hundreds of times. Give yourself permission to sit with that disorientation for a moment. It does not mean you are sicker than you feel. It means the tests are finding what your body has been quietly compensating for. If treatment is recommended, whether that is medication, lifestyle changes, a cardiologist referral, or all 3, the first few weeks are often the most challenging. New medications have adjustment periods. Dietary changes require habit rebuilding. The body does not transform in a week. This is not a failure. This is medicine as it actually works. Week 4 through 12. This is where something important begins to happen. If you are monitoring your blood pressure at home, you may start to see numbers shifting. If you were tracking breathlessness on stairs, you may notice it has become slightly less noticeable. Your sleep may feel more restful, though you might not be able to articulate exactly why. Your ankles may look less swollen at the end of the day. These are small things, but they are real things, and they matter because they mean the intervention is working. The process that was quietly progressing has been interrupted. I am not going to promise you dramatic results in 30 days. I will not tell you your numbers will return to perfect in 3 months. What I will tell you is this: if you identify these signs and act on them, the direction of travel changes. That is the promise of early detection, not cure. Direction. And now I want to address something I hear from patients regularly at this point in the conversation. They say, if these signs were there, why did nobody catch them at my last checkup? The answer comes back to what I said at the beginning. A 7-minute standard checkup screens for the most obvious red flags. It does not involve the kind of careful clinical observation I have described today. Your blood pressure is measured, your weight is noted, your prescription is renewed. Unless you mention specific symptoms, the more subtle signs go unexamined. But you are not a passive participant in your own healthcare. You never have to be. You can learn to observe. You can bring observations to your doctor. You can be your own first line of detection. That is precisely what this video is for. Let me give you a practical action step right now. Take the next 10 minutes after this video ends and do the following. Check your pulse for 60 seconds. Note whether it is regular or irregular. Press your thumb into your ankle just above the bone. Note whether a dent remains. Look at your eyelids in a mirror near a bright light. Note whether you see any yellowish patches. Ask yourself honestly how many pillows you need to breathe comfortably at night, and think about the last time you climbed a single flight of stairs. How did you feel at the top compared to a year ago? Write down what you find, not to diagnose yourself, but to have a clear, specific set of observations ready for your next medical appointment. Specificity is power in a medical consultation. I have been a bit tired lately gets one kind of response. I noticed a dent remaining in my ankle for about 4 seconds when I pressed on it, and I have been sleeping with 3 pillows for the past 18 months gets a completely different kind of response. Be specific. Be the person who walks in with observations, not just feelings. Now, here is something I want to address directly before we close. The 7 signs I have described today do not in isolation confirm heart disease. Some of them have other possible explanations. Ankle swelling has other causes. Breathlessness on stairs can be a fitness issue or a lung issue, not only a cardiac one. Xanthelasma can occur with normal cholesterol in some individuals. But none of these signs should be ignored. Every one of them is a reason to have a conversation with your doctor, a reason to ask for a more complete evaluation, a reason to check rather than assume. The earlier heart disease is identified, the more options exist. In the very early stages, lifestyle modification, dietary changes, and targeted medications can slow or halt progression significantly. At later stages, the options narrow. The window does not stay open indefinitely. Sandra called me 6 months after that initial appointment. She had lost 11 pounds. Her cholesterol was being managed. The diastolic dysfunction had not progressed on her follow-up echocardiogram. She had gone back to sleeping with 1 pillow. Just 1. She called to tell me that specifically. She said, "I walked up the stairs at my daughter's house last Sunday without stopping to rest. I have not done that in at least a year." Her daughter got on the phone and she said, "Thank you for seeing what we did not know to see. That is why I make these videos." Type "I finished" in the comments if you stayed all the way through this with me today. And then do something that matters. Share this video with one specific person in your life, not just a general share. One person, your mother, your father, your older sibling, your neighbor who mentioned something about their ankles last week, the person who just celebrated their 60th birthday and thinks they feel fine. Because feeling fine is not the same as being fine. And now you know the difference. There is one more thing I want to share with you in a future video, something that nearly 60% of people over 60 are doing every single morning without realizing it quietly accelerates arterial stiffening, even in people who otherwise eat well and exercise regularly. It connects directly to everything I discussed today, and the solution is simpler than you will expect. That is coming very soon. Do not let anyone tell you it is too late, because it is not.